Irreverent, entertaining, cool. You're listening to LA Talk Radio.
You're listening to Peace Fund Radio with Ethan Dettenmaier and Adrian Paul, right here on LA Talk Radio.
Good morning. Welcome to Peace Fund Radio. Lucky for you, Adrian is stuck in traffic. Even more fortunate for you, John Beerley is filling in until he gets here. He is live from a secret, undisclosed location in Indiana with all the news, notes, and information regarding young heroes who make the world a better place because they are in it doing good work when the rest of us sit on our couches eating donuts. So now's a chance to profile those that matter. Welcome to Peace Fund Radio. Like I said, Adrian will be here any day, any minute, any day. You know how that guy is. John, how are you? I'm sorry, John. Now answer the question now that you're unmuted. How are you, John?
I'm doing very well, Ethan. How are you?
Fantastic. It's nice to be starting the show with you. It's a little change of pace for the audience's sake. Adrian will be here soon.
It is. Adrian is languishing in traffic, but he will be joining us very soon.
I've actually never seen Riverside Drive so deserted from the window of the studio here. So it is fascinating that he's languishing in traffic somewhere. I'm not sure where he is, but it looks like a zombie apocalypse downstairs.
Well, I wanted to go ahead and actually, while we're waiting for Adrian to get in, talk about actually being in a hot car at this time of year. It's very dangerous, and it's especially dangerous for children.
Yes.
So far in 2015, 9 children have died in the United States from being left in hot cars. That's unbelievable to me. It takes 10 minutes for a car to reach a temperature on an 80-degree day that's enough for a child to have a heat stroke.
Yeah, and speaking of heat strokes, walking into the studio now is Adrian. Yeah, with a yoga mat. It's a rough day, but
you have to come prepared. Let me
turn on his mic so he can weigh in on this, because this is an important topic and one I think everyone should know about. Heat strokes, car temperatures rising.
Good morning.
Good morning. Yeah.
Good morning,
welcome
Adrian.
To your own show. How are you?
Traffic is ridiculous.
Doesn't look ridiculous.
Bumper to bumper, and then all of a sudden it goes. They're one of those police cars doing the...
Look, man, I don't know where you come from. You don't have to explain your tardiness to me, buddy, okay? Not to sound like a Van Halen video, but I don't really...
But aren't you a Van Halen video? This is what I want to know.
My life is a Van Halen video, that's for sure.
That's what I meant.
It has been for 20 years, but I got to tell you, I'm just glad you're here. I think the audience is probably more glad. John Beerley was just wowing us with some facts that are actually quite stunning about the possible fatalities and situations in cars, and I think it's actually very interesting. So when you're in a place to let him resume, we'll kick it off.
Well, actually, did you are you talking about the girl that was in the car, the young child?
We have not gotten to that one yet. No, we had just started just with some basic figures. There have been two big stories this week about children trapped in cars.
Way to jump the shark on that, Adrian. He comes in with the punchline about the girl in the car. John, why don't you take it from the top? I think this is a very, very important topic, and we shouldn't be making light of this.
As we had said, it takes 10 minutes for a car to reach deadly temperatures on an 80-degree day, much less a triple-digit day like we're having across the country right now. It takes even less time than that for heat stroke to start. The average number of children who die from vehicular heat stroke in the United States every year is 38 kids. How needless is that? And 80% of these deaths are children under the age of 2. There was a 2-year-old girl in Dallas, Texas, who died very recently after being trapped in a hot car while her parents were taking a nap. They completely forgot about her. She was left strapped to her car seat, and it's just it's tragic.
That is actually very painful to hear. My heart hurts hearing that. Actually, that's painful.
Yeah, it's unnecessary. That's what it is. It's Anyway, carry on, John. Sorry.
Well, even though that story unfortunately had a tragic ending, there was one that had a better ending just yesterday in Merriam, Kansas, where Sarah Oropeza, who's the manager of a footwear store there, was just going about her day. One of her employees who had just gotten off work comes running back into the store saying that there is a little girl, 2 years old, locked inside of a car, who is just completely covered in sweat. Her clothing is soaked through, her hair is soaked. They can look through the window and see that her shoes and her socks are soaked with sweat. The car is locked. Nobody can get inside of it. So Sarah runs out there. She's got everybody in the parking lot, all of these other concerned people who are trying to help people with screwdrivers, other implements to try to get in the car. Sarah takes it upon herself to get a tire iron and smashes the window of the car. It takes her 3 minutes to smash through the window of the car with this tire iron. They're able to get the little girl out. She's fine. She's going to be okay. They were able to get her inside, help her cool down a little bit. Again, this 2-year-old girl, completely drenched in sweat. She might have had minutes before she would have passed away.
Can I ask a question about this real quick?
Yes.
Is that the protocol? Let's just say you're unfortunate enough to be in a situation. I'm looking at Adrian here, but I'm also asking you, John. Little kid in a car, clearly in a bad situation. It's an oven in there. Is it... I mean, my reflect would be to bust a window, too. But I could just see the lawsuits and,
I wouldn't care at that particular point.
Well, I wouldn't care either, but I'm asking, what is the actual protocol? Like, what do you do from a civic
the protocol always, in a case like this, is, if you see a child in a vehicle alone on a hot day, even if the windows are cracked, call 911, let somebody know. But I think
that's a joke.
The reason that Ms. Oropeza acted the way she did was because the little girl, really looked like she was in dire straits, and I just don't think that they had any time.
But that's no time.
That's good advice, but 911 is a joke.
It's not a joke. I wouldn't say it's a joke. It's just a question of time to get there. Mm-hmm. If they've got to get through traffic, they've got to... In the 5 minutes it takes them to get there, that child could be in serious trouble.
The last time I called 911, I was on hold for 9 minutes.
That's problematic.
So that would have to be solved. But is it? I think we're all alike. The three of us, we would probably bust that window.
Now, can I just go back to what you just said, Ethan? Because we have dealt with 911 for kids before, and one of the issues about 911 are people calling 911 for ridiculous things that they should not be calling 911 for, and therefore hold the line up for people like you that had to wait 9 minutes. So you've got to understand that when you do something like 911, oh look, my paint's peeling off my window, I need some help. That's not why you call 911.
No, I agree, but we all have common sense. I'm with you on that.
We don't all have common sense because I've actually dealt with the operators doing it.
We're talking about us in the studio.
Oh, I don't know about that.
If we all had common sense, we would have no need for this show because it's so educational. But
and one of the saddest parts I think about this entire story is that when the people in charge, well, first of all, Sarah and the other women who worked at the footwear store went out and bought diapers for the child because even though this 2-year-old was in the car, there was no diaper bag, there was nothing in the car at all for the child. So Sarah and her friends purchased diapers for the little girl until finally a couple comes in and says,
shouldn't you be charged with negligence?
You absolutely
shouldn't you be charged with negligence for that type of thing?
Do you know what they were concerned about? How can you leave your child in
the car like that?
The people who were in charge of the child, their only question to the police was, is the insurance going to pay for the window that lady broke? No concern for the child, just they were worried about their window. So the police ticketed the couple for child endangerment, and the little girl was picked up by her godmother, and the case is getting ready to go to Johnson County District Attorney Office in Merriam, Kansas, and hopefully something...
There is a video online that I watched this morning. I actually watched the thing, her shoes were wet. Her socks were wet. She was drenched in sweat, this poor little
Absolutely drenched. Unbelievable.
So she's sitting in the car. The windows are fully rolled up. And when they try break... Now, this is what's interesting. You watch the video. They're trying to break the window. The window does not break for a good 3 or 4 minutes. They're smashing... They hit it with a screwdriver. They hit it with something else. They went and found a tire iron. Even with the tire iron breaking the window, eventually it broke. But, there was... You could see the people on the window there and watching this woman smack the car window several times to break the window. And now that alone must have scared the little girl. She's seeing all these people running outside. Not only is it life-threatening, it's also traumatic for the poor thing.
Right.
So
it's... Ugh.
Well, God. Yes, this is in the news right now. We have to bring you these things because I think that these are issues that have to be talked about. And it wasn't the focus of our show this morning, but I think it's a very important thing that we need to bring to public attention when things like this happen. So, but this month we're still focusing on aiding children. Last week we had Sean Patrick Flannery on. You can listen to the show in our archives if you want. It was a great show. He has a lot to talk about. I really respect what he does and what he stands for to help kids and his martial arts background. Mm-hmm. we deal with aid, and that's a very broad term, but with back to school just around the corner, I want to discuss immunization from around the globe to the ongoing vaccine debate here in the US. Now, this is a very hot topic at the moment. And just so that those of you out there, my view on this is, and people will not like this view, I do not believe we should be forced into telling our kids, making our kids do things. If you look at the statistics abroad, the immunization abroad, the kids that have to do, there's 10 immunizations they have to do. Here in the US, it's between 30 to 40 immunizations for a child. Now, I'm going to give you a case. Yesterday, I was discussing with an attorney, a very well-respected attorney here in the U.S., in Los Angeles, whose child, when he was 2 years old, was perfectly fine. He went to have an immunization, and because the mercury in the immunization shots was so high, it caused him immense stress for the next 8 to 10 years. And I'm talking autism. I'm not talking just something normal. He cannot speak, he cannot look at people, he cannot do anything because of that immunization. We have to know what's in those things that we are giving our children. Why do we allow somebody else to tell us what we should do with our child? I don't agree with that. I'm sorry, but that's my point. Vaccines do work, but we have to know what's in them. We can't be governed by the state to tell us you've got to do this. Well, give us all the information about what you're giving our children. That should be the first thing that we should be asking. Sorry, I'm very passionate about this, but this is just not right. How many children in developing countries lack vaccines? This is true, because they live in hard-to-reach communities, the most marginalised members of the community, and vaccines do help children. I do agree with this, but we cannot be forced to giving them arbitrarily vaccines across the board. So everyone's gone silent on this.
Can't you object on it on religious grounds?
No, that's the thing. You cannot object on religious grounds. If you do not do it in public schools in California now, your child would not be allowed in public or private schools.
So homeschool
and
is an
even
alternative?
That's even the option. However, if the nurse comes in and says that they need to vaccine your child and you say no, you can be fined and put in jail, even at homeschool.
I think that's ridiculous, although I'm for vaccinations.
This is Big Brother. You're talking about having a society that's telling you exactly how you should move and what you should do.
Well, speaking of Big Brother, one of the reasons I'm worried about it is the next step is when they want to put a chip in every human being is some sort of psycho GPS tracking device. You're all going to have to be forced to accept it. That's already happening. That's right around the corner.
That's already happening.
And I refuse to have that done. I'm going to tell you right now, we're going out in a blaze of glory if that gets enforced.
Yeah, well, I mean, the fact of this, the more people that stand up and say this is not correct, this is not right, we need to have our rights. Our rights are we need to be able to say what happens for our children in our lives.
I agree.
Why should we be dictated by somebody that has a different agenda? I do not believe this is solely for the people who want to have the kids immunized against disease. I believe it is something to do with the medical institutions in this country that control all these products. You don't think that's not going to cost us more money? Of course it is. I'm sorry, I'm very, passionate about this. Yes, the facts are one child dies every 20 seconds from a disease preventable by vaccine. Yes, nearly 17% of all deaths in children under 5 are vaccine preventable. Over 1 million infants and young children die every year from pneumococcal disease and rotavirus diarrhea. Yes. But please, tell us what you're giving our children. You can't just say, let's immunize them across the board and let's be done with it, because that's the safest method. Because you just don't know what the after effects are. You don't know what they are tomorrow. You don't know what they are in 5 or 10 years' time.
It's an interesting, too. I mean, you look at it from just kind of a devil's advocate perspective. You can say, okay, well, I don't want my children to be forced to have vaccines. But then on the other hand, you can have someone else say, well, okay, well, I don't want your children then around my children if I know that they haven't been vaccinated, because I don't want them to catch something that your kids might have. Again, it's kind of a
correct. But isn't it the fact that that's a choice, though, isn't it? Don't we have freedom of being able to do what we want in this country rather than being dictated to do things? That's part of the reason I came here, so that I could, I have freedom of speech. I have the freedom to voice what I want to voice without having fear of being, fined or put in jail to do it. And, I know there are a lot of mothers that are going to hate me for this because they're going to disagree. Then they say, no, everybody should be vaccinated. Yes, I agree. You should have vaccines. However, why not know what is in the vaccine? Why shouldn't we decide, okay, that item in that vaccine, has it been totally tested? Yes, it's FDA approved, but if there's a recourse, where's the recourse? Does it go to the medical profession? Do they give us back money or our child's lives if it backfires? I'm sorry, I just don't agree with all of this. A child, when a child is born, people automatically, in the hospitals, they give them a vitamin K shot. Vitamin K does not need to be administered with a shot. It is also orally, you can give it orally. But they don't care. It's how they used to do it, and they're going to continue doing it. A baby that just comes out here and gets stuck by a needle, you think it's going to be happy? No, it's not. So that's why I'm there are certain things that are old. They're old institutions that are still trying to put their stamp on the way we operate. Now, I made the show silent for a second, and probably a lot of people turned off. But the thing is, yes, you have coordinated worldwide vaccination efforts. They've made significant progress. We've got vaccines to prevent, the primary causes of pneumonia and diarrhea, the two leading causes of childhood mortality. But, let's think about this for a second. We're talking about a child having something that might be a cold or we have flu vaccines. I think that's the biggest waste of time ever. A flu vaccine half the time gives you the virus, first of all. And my mother said to me, and this is God's honest truth. My father-in-law, not my mum, my father-in-law said, you guys should go and get your flu vaccine. You guys should go and get your flu vaccine. We said, well, no, I'm not taking the flu vaccine. I don't want to go and pay for something I don't think I'm necessarily going to get. So he went and got the flu vaccine, and guess what? He got the flu. So
no, I am the same way with the flu vaccine. I haven't gotten it I have not taken that vaccine in probably a dozen years, because the few times I did take it, I got really sick from it. But I think it's a situation where every person is different, and I think maybe the answer to your concerns, Adrian, might be that maybe there should be more of a process of tailoring things to specific cases in children sometimes, rather than just saying this is an across the board thing that applies to every child, when every child simply isn't the same.
That's my point.
Do you think there's something maybe to that as a solution?
Yes, I agree. That's my point. I mean, you've got 1 in 5 kids in developing countries don't receive life-saving immunizations to protect them against things like measles or pneumonia or diarrhea and polio. Those are life-threatening diseases. However, certain other children don't need it in certain. In this country, I believe polio was almost eradicated, and as was, what was the other one?
Almost.
I believe it was, wasn't it measles recent, and then there was a recent measles outbreak.
Yes, at Disney World, actually, wasn't it?
That's what happened, and that's what's caused this furor. That's what's caused it, is because that happened. And everybody went, oh, everybody should be immunized. So now the state legislators say, oh, okay, let's do this. And now that'll solve the problem. Well, it doesn't solve the problem, because you're tarring everybody with the same brush. Immunization programs in resource-poor countries, they're faced with barriers, which are barriers we still face, because to a degree, they to a much more deeper concern. They have shortages of trained staff and supervisors and vaccines and reliable power supply. We've got the same thing. We have supply. Sometimes the supervisors and the staff are not maybe as trained. You're going to say you've got to vaccinate them. Okay, so you go to a doctor that might not know too much about how well do you know your doctor? I went to a doctor the other day and said, well, we could operate this. I'm like, Are you living in the dark ages? Your idea of just fixing a problem is operating on something. No. I mean, I didn't have anything wrong, but he said, well, if there was, we would probably do that. And I'm like, and this woman, let me tell you something else. This woman, who I talked to you about earlier on in the show, said that she went to a doctor at UCLA, and I'm going to mention UCLA because they're a very good institution, but however, they are a very controlled institution into doing the regulations as the institution around it tell them, and the medical institution tell them how to do it. They told the woman, oh, well, your son now has got autism, you should possibly have another kid because, this is not going to get much better. And she said to the woman, she said, you know what? Is that your plaque for your doctor on the wall? She said, yeah, that's mine. She said, you should take it down because I don't think you should call yourself a doctor. So this woman went away and found alternative medicine that has now brought her son back to out of 10. He's like at an 8. He's very. I spoke to him yesterday. He plays the piano. He's yes, he has some issues, but He's a huge difference from when he was 2 years old compared to what this doctor had told him. So my point is, let's find out why and how these things happen, and let's get the information rather than just saying let's give it to everybody.
I agree. Good story.
So let's go back. I mean, I was just talking right now about the barriers that the staff and the supervisors. These places, they're in some remote locations. They have a very weak health service. They've got lack of education, which is one of my things. Educate people about what they're taking and why they're taking it and how it should be taken. So they have a conflict. It can prevent children from getting the vaccinations they need. Many developing countries have an inadequate cold chain, which basically means the optimal temperature control for transport, storage, and handling of vaccines. Hopefully here in the United States, we don't have that issue. They have the problem of managing vaccine stocks effectively, which basically means if they produce a vaccine and all of a sudden that goes stale, are they going to give it to them arbitrarily saying, we left it in the 100-degree heat last week, but, it should be okay. There's a control, There are preventable diseases. There are measles and polio and tetanus, rotavirus. Those are the preventable things. Now, for those of you, measles, you ever have chicken pox when you were a kid?
Yeah, of course.
What about you, John? Did you? I had them too, Terrible, itchy, bloody pain in the... it was horrible. But it's not life-threatening.
No, they used to want all of us to get it, so we'd get it out.
Here we go again. Same thing. They want everybody to take the vaccine so nobody else gets it. To a degree, there are certain things... it's the responsibility. Unfortunately, I understand where the problem here lies, because you're relying then on the responsibility of the parents for the kid. And I see this in my daughter's and my son's schools, the parents that have kids that are sick bring the kids into the school, and then everybody else gets sick. So it's like a little a petri dish. You get all the thing gets in there, and they all get mixed up, and they go home and they spread it everywhere else. So that's part of the other issue. So is there a way to prevent that? I don't know. That's a discussion we should open up in a sense, because how do you stop that? How do the schools handle it? Should they have a medical check for the children during the day, or should it just be let's give the kid a vaccine and let's just hope they're not going to get it? Remember, when you give people a vaccine, they do get a case of it. They're giving them a portion of that virus to stop them from outbreaking in a major way. So, measles, one of the most contagious and infectious diseases, spreads through coughing and sneezing. 90% of unimmunized people who come into contact with an infected person will catch it. The Measles and Rubella Initiative has vaccinated more than 1 billion children in 60 countries, reducing measles globally by the deaths from them by 74%. Now, despite this, it still kills an estimated 400 people a day.
Does it?
Yeah.
A day?
A day. 450 people a day. So there are... I am not saying we should not immunize. I'm saying we should not do it across the board and be forced into doing it. Polio. Polio attacks the child's nervous system. Terrible, terrible disease, and can cause muscle weakness, paralysis, or even death. Thanks to the polio vaccination, 5 million people who would otherwise be paralyzed are walking, and polio cases are down 99%. Never before has the world been this close to eradicating polio. So, now, how does it... It's still an endemic in 3 countries, in Afghanistan, Nigeria, and Pakistan. In India... They were removed from the list in 2012, January 2012. That is awesome. And that is because it's attacking the nervous system. So it's a very bad disease. I've seen children with polio. It's not fun.
No, it's not.
It really isn't. Another one I just mentioned, which was tetanus. And I never did. Did you ever get tetanus shots? They hurt like hell.
Yeah, I remember getting those.
What about you, John? Did you get those?
Let me tell you a little story about a tetanus shot, Adrian. I had I actually cut my finger on a replica of your Highlander sword and had to get a tetanus shot in 1994. So, thanks a lot for that.
Hold on a second. Wait a minute. Thanks a lot for that. You were the one that cut yourself.
Yeah.
I didn't. You can't put that on me.
That's ridiculous. That's like locking your kid in the car. Come on.
That's nice. So what were you doing? What were you doing with the blade, John? That's the thing I want to know.
I'm sorry?
What were you doing with the blade?
I was actually cleaning it, and it slipped in my hand, and it's not even a cool story. It's the lamest story anyone ever has about.
Hold on a second.
Getting
that blade. What blade did you cut? Was it a stainless steel blade?
It was. Yes.
Was it rusty or something?
No, not at all. Not at all. You took a tetanus shot because you cut yourself on a piece of metal. Yes, I did.
We're paranoid Americans.
I'm kind of like, how many times have people fallen over?
It was deep. There were stitches.
Oh, there were stitches. Oh, well,
there were stitches.
Oh, okay. I'm just thinking it was like you nicked yourself or something.
No.
Where did you cut yourself? On your hand?
It was the webbing between my thumb and forefinger.
Oh dear.
Yes.
Oh dear.
Yes.
So you couldn't click your fingers for a while, right?
It was a little difficult, but I persevered.
Look, I mean, I know we're joking about this, but tetanus isn't a funny disease. It's excruciating. It kills one newborn every 11 minutes and approximately 134 babies every day. I mean, typically contracted through unhygienic childbirth practices. Now, we are talking tetanus in a unhygienic childbirth practice. Therefore, that's possibly in undeveloped countries, and that's why, hopefully in this country we don't have that issue. I'd be interested to find out whether there are any cases of children being contracting it or dying from it in this country in the past 5 to 10 years. It'd be an interesting thing. Somebody might be able to tweet out for us. But since 1999, UNICEF. They've immunized more than 118 million women in 50 countries against tetanus and eliminated the disease in 35 countries. So, I mean, I love UNICEF. I think they're a great organization. But the disease is still a public health threat in 24 countries.
One quick thing here, Adrian, UNICEF has helped to eliminate maternal and neonatal tetanus in most countries. There are 22 countries in Africa, Asia, Europe, and North America where it still strikes babies and mothers who have little or no access to health care or who live in remote areas or are caught in humanitarian emergencies.
So you said North America, right? You did say North America and
Europe.
Europe.
On the list.
Okay, so let's. I'll be curious to see where that kind of has happened. And in what circumstance?
I'm digging deeper into that as we speak.
Look, let's get on to that. While you're finding that, the rotavirus. I mean, we are already at 11:30, and I haven't even gotten through half the stuff I want to talk about. The rotavirus, it's the most common cause of severe diarrhea amongst infants and young children. Each year, more than 500,000 children under age 5 die as a result of rotavirus, and almost 2 million more become severely ill. So if your child has diarrhea and they're screaming, there is a reason. Make sure you go in and have them seen to, because it is excruciating, and severe diarrhea is not fun for kids. And that can be prevented. So these are things that we highlight this morning because they are serious diseases that need to be immunized against. Let's talk about the vaccine debate in the US. It has this outbreak in Disneyland has fueled this vaccine debate. In the first 2 months of 2015, more than 150 cases in 17 states were reported by the Center for Disease Prevention and the CDC. And most of the cases involve people who didn't receive the measles, mumps, rubella, MMR vaccine and can be traced back to the Disneyland outbreak. But additional outbreaks, including one in a daycare center outside of Chicago, popped up unrelated. Now, it comes on the heels of a serious whooping cough outbreak from 2012 to 2014. Medical experts blame the spread of these highly contagious illnesses on a growing anti-vaccination trend amongst today's parents. California, and of course they would, they're going to blame it on somebody. But anyway, California and Arizona both saw nearly 70% increase in vaccination as exemptions from 2009 to 2013. Well, that's not going to happen now with this new law that they put in, is it? The anti-vaccination trend appears to be occurring in pockets, certain towns or school communities, which can create hotspots for diseases to easily spread to unvaccinated people, including infants who have not yet received all of their vaccines. Okay, well, the problem... out of sight, out of mind. We've become prisoners of our own success. Nobody knows what measles is. So I think it's very important for people to understand what that is. Medical experts and the CDC have hailed immunizations as one of the greatest public health achievements in history. Yes, But again, my point is, why do we have to do it across the board? But few of today's parents were alive to see the effects of deadly crippling diseases like polio, diphtheria, measles and mumps, which their parents and grandparents probably witnessed or experienced firsthand. Those, as we said, are not the fun diseases to have. But when you're talking 30 to 40 immunizations for a child below the age of 5 or 6 years old or before 7 years old, it seems a very large amount to me. That's so serious cases. Those who don't think they should vaccinate their children, that think diseases that prevent are no longer a serious threat. We've discussed globally, measles killed more children than car accidents, drowning or AIDS in 2013, and measles are still dangerous in the US, where nearly 1/3 of children who contract it under age 5 end up in hospital. So these cases can lead to pneumonia, brain damage, deafness, and death. There is a confusion about vaccines and autism. Here, actually, we were discussing it a little bit before, and again, this is going by a medical paper that we have here. We were on the verge of eradicating measles by the year 2000. A medical journal in the United Kingdom called The Lancet published a paper in 1998 that shook global confidence in the safety of the MMR vaccine. The paper by Andrew Wakefield claimed that there might be a link between autism and the vaccine. I've just talked about it. Wakefield sensationalized his study in a press conference, calling MMR vaccine a moral issue and something he could no longer support. But The Lancet retracted Wakefield's paper in 2010 after an investigation revealed that he distorted the data and acted unethically. The UK revoked Wakefield's medical license the same year, calling him irresponsible and dishonest. The media reported on Wakefield's elaborate fraud, but by then misinformation had spread. Now, this is possibly something that he did because he saw the danger to it, but I'm telling you, I know firsthand that there is a link to this child. There was 2 or 3 cases reported to me by this lady whose child was affected. She said within 24 hours, her child had stopped looking at her, being able to respond, looking to the floor, could not react. That was within 24 hours of it taking. So you're telling me that it was not the vaccine. Well, then what was it? So my point is, in that vaccine, there is a huge amount of mercury. You cannot take mercury out of your system. It is the hardest metal to get out of your system, if not impossible. It is not totally impossible. There is a doctor that I know that I was told of that has a cure to doing that. I can possibly put that information on our site later on. I don't have those facts in front of me right now. However, the fact is that is a very dangerous metal to have, mercury. And we're being... Think about it, everybody. This is not just a kid's issue. This is also an adult issue. Mercury in fish today, in tuna, and things like that is very dangerous. And we are ingesting it, and it will not go out of your system because mercury is the hardest metal to get out of your body. And it will affect you in the long run. Now, measles outbreak. Let's go back to this for a second. Actually, let's hold off for a second because, we do have the laws changing. I want to talk a little bit about a hero of the week right now because I've been going on this morning, John, and I know you've got something great to talk to us about this morning. So please go ahead.
It's a passionate topic. Before I jump into today's brand new hero of the week, I wanted to give a quick update on one of our frequent guests and heroes, Dalton Sear, 15-year-old. Happy birthday, Dalton, by the way. Just turned 15 a couple days ago. Singer and songwriter from Florida, who has done a lot of work for anti-bullying causes, for veterans' families, and working with the Dream Factory as a national ambassador for wish fulfillment. He's spent the entire month of July performing in children's hospitals around the United States for kids, and he's currently starring in an Amazon.com pilot called The History of Radness, which is a musical-based show where he plays a member of a group of kids who start their own band. Henry Rollins is in the show, music by James Iha from the Smashing Pumpkins, and we would just love it if everybody out there would go to Amazon.com and rate it, review it. The more reviews they get, the bigger chance it has of actually going to series. And then the higher profile Dalton has, the more children he can reach and help with his incredible charitable endeavor. So check Dalton out, and congratulations to him for that success. Now, today's Hero of the Week. I say this every week before we start the Hero of the Week story. I always say this one's really cool, and this one is just fantastic. I love how unique these stories are. We're going to go back in time to 2010 and around the world to India. 12-year-old Ruchita Zaparde of Plainsboro, New Jersey, visits India with her family, and she meets Asha, a 27-year-old widow who is struggling to make ends meet for herself and for her two small daughters. Like many of the 40 million widowed women in India, Asha and her children were disowned by her husband's family upon his death, kicked out, abandoned to fend for themselves. Women such as Asha are shunned and isolated by society. They are forbidden to remarry, and they find it nearly impossible to find work. Asha struggled to make ends meet. She did hard labor on farms during the day. She repaired clothes with a needle and thread for people in her village at night, but it just wasn't enough. She had to pull her little girls out of school and put them to work too. She hated to do it, but the alternative was homelessness and starvation for her little girls. She just couldn't let that happen. When Ruchita got back to the United States, she couldn't stop thinking about Asha and her daughters. And there was one detail of Asha's story that she just could not get out of her mind. And that was that Asha was very good with a needle and thread, repairing clothing. And that gave Ruchita an idea. She organized a fundraiser at her school. She returned to that village in India. She found Asha, and she gave Asha two things: a sewing machine and a fighting chance. Within a year, Asha was supporting herself on a steady income as a seamstress, and her two little girls were back in school. Now, question to you guys, Adrian and Ethan. Knowing what you know about our Heroes of the Week, do you think that Ruchita helped this one person and retired?
No.
No. Just as all of our previous Peace on Radio Heroes of the Week, Ruchita had realized the power of having an idea, committing to that idea, and following through with it. She saw what she could accomplish. She saw the success that Asha had with her sewing machine, and she knew she could use that same method to change the lives of other women just like Asha. So to continue her work, Ruchita founded a 501c3 charity called Sew a Future, SEWA Future.org. For $110, Ruchita is able to provide a woman in India with a sewing machine, enough thread and fabric to get started, and seamstress training if necessary, giving these women the power to lift themselves up and create their own futures again. There was Chanda, whose husband committed suicide because he couldn't pay off his debts, leaving Chanda to care for her two small children and her elderly parents with no income. There was Rakhi, who lost her father to an automobile accident and had to leave school to help her mother work on a farm. There was Chaya, who made less than $1 a day to support herself and two small sons after her husband passed away. Chanda now supports herself, her children, and her parents. Rakhi is back in school, while her mother uses her sewing machine as a successful seamstress. And Chaya went from $1 a day to being well on her way to affording her own house for herself and her little boys. These are just a few of the 217 women who've gained self-sufficiency, opportunity, and educations for themselves, for their children, all because a 12-year-old girl from the other side of the world had a unique idea and followed through on her dream to help those in need. Ruchita just turned 18 a couple of weeks ago. She attended the We Are Family Foundation's 3.Dash Summit for Global Teen Leaders in New York City this year. She manages 1,400 volunteers in 57 schools across the United States. She has already expanded her efforts into Taiwan and the Bahamas, and they are on track to helping an additional 100 women this year with sewing machines. So for all the lives she has changed, for the lives she will change, Ruchita Zaparde joins the ranks as our newest Peace Fund Radio Hero of the Week.
Awesome.
Yeah, brilliant.
Awesome.
No, I mean, seriously, I mean, a 12-year-old girl decided to do that, and it always stuns me. And I talk to people a lot about this, how, young people in our world are making a difference. And I think this goes to the fact that we live in a time where there is a huge upheaval in our consciousness. there is a time here that there is a very dark force working and a very positive force working. And we need to be aware that those dark forces affect our life on a daily basis. That's why I'm saying to you, when you are given things by somebody, don't just take it arbitrarily. Make up your own mind whether or not it is safe for you and your family to take or follow that path that somebody has told you about. The internet is a fantastic place now to find information. You can go to, if you want your child vaccinated, which we've been talking about this morning, the Vaccines for Children program is a free program, federally funded, that provides vaccines at no cost to children. However, my point is, make sure you know what vaccines you're giving your children and the side effects and the things that they do to them. You need to know that, because when you have the communities and the states, such as California, that signed into law this month the SB 227 bill that eliminates personal religious beliefs as exemptions from school vaccine requirements, that is an issue that is now taking our lives into their own hands and not allowing us the choice to decide whether that vaccine is safe for our children and us to take, because we need to find out more about that. That is my point on this. I think it's very important to know. And we have the ability now to make these decisions. These children that we are bringing you will hopefully be those people that bring light to this world, that stop the things such as the horrors that we hear every day of child prostitution and children in war zones and kids that are being put into slave labor and sold as sex slaves. All these issues that we have, there's a dark forces in this world. You cannot understand that, or you must take into account that there are governmental money-making machines that do not care, even though they have charity programs. You've got to look deeper into what their dealings are to know that they might not necessarily be the good guys. They are hiding behind a cloak of, we actually do this charity anyway, but we do that because it's a tax write-off, and it's not necessarily what our business is. Our business is actually, we'll make the manufacturing parts that sell guns to people that use them for war and things of that nature. So let's be aware of that. That's what I'm saying. Let's be aware of the things that we do in our world and see whether or not we can make a difference and put that onto our children to make the difference for us.
And one of the things that I like about a story such as Ruchita's, and by the way, I spoke to Ruchita earlier today before the show, and sometime in the next few weeks she's going to actually call into the show with some updates and talk about some of her experiences working directly with some of the children that she's been able to help. I mean, this is a young woman who had a very specific idea, sewing machines. And it doesn't, there's no one answer to ending poverty. There's no one answer to ending global hunger. But it's amazing to me when these young people such as Ruchita come up with these very specific solutions that work. And you think about the children. Adrian, had listed all of the dangers to children in rural India, such as crime and prostitution, sexual slavery, some of the traps that these children fall into. The women who Ruchita are helping, their children are able to go back to school. And you never know when one of those children who was helped by one of our heroes of the week might grow up and say, you know what, when I was little, I was on the precipice of having my life take a terrible turn. And someone from around the world, a young person just like me, helped me and helped my family. And now I'm going to commit myself to doing that for others as well. And one of these kids who might have ended up a statistic ends up curing cancer or coming up with a solution to some huge global problem. You never know. And that's why I love these stories.
I think you're right there, John. I mean, again, going to the fact of the child had the idea, but the parents were able to support the idea.
Yes, absolutely.
And I think that's what I'm talking about, the light in the world, that, we have the choice to either say, no, don't do that, or yes, let me help you along the way. And I think the more of us that take the time, yes, we have busy lives. Yes, we have our children to support, our families to support, our houses to keep. And there are a lot of unfortunate people that do not have that. But we can make that time, that extra half an hour, to make a decision, to do a little research on things, to help our children if they want to create something that would change the lives of somebody else. Because like you said, John, this one life or two lives that you change somewhere else may affect us or our children or our future generations in years to come. So I think we have to be aware of that, and change can only happen when we make the decision as parents or as adults to help the children, help our society.
Absolutely.
So, what do you think about this, Ethan? I mean, I know I've been rattling on this morning and a lot of stuff. What's your kind of take on some of the stuff I've been sort of talking about this morning? It's a very hot topic. It's a very,
Well, first, I'd like to say I think you should be late more often, because you, when you come in, when you come in tardy, I should say. You come in focused on a point, passionate about a point. You have more of a desire to jump into a topic and speak honestly about it in a way that I think all of us can relate to. So do me a favor and show up late from here on out.
But hopefully I'm not going to get, nice of you to show up for your own show.
It was, in fact, nice of you to... Now, you could get whatever connotation from that you like, but it was, in fact, nice of you to show up for your own show. But, I mean, these issues, the hero actually is quite inspiring. But aside from that, I mean, I think what's more troubling about this, the situation with children in the car, the vaccination issue, the overall blanket vaccination of society without really doing any real scientific research. It's all sort of been a troubling show for me, because it shows both the level of human ignorance where the parents are concerned, just the general stupidity we combat in our day-to-day life, and just the need for our government to have sort of blanket solutions that it can enforce at will. And it's basically almost a cryptic demonstration of what your future is going to look like from here on out, when somebody in the state legislature, or somebody who owns the state legislature, and there's plenty of people out there who have a stake in it financially, just wants to force something through. I mean, what happens when Merck decides to put the money behind a governor that they get elected?
Well, look, this happens, and you know for a fact that insurance companies are going to hate me for this, but insurance company have 4 lobbyists per senator, per representative in the House, because they're pushing through insurance things which affect the insurance, such as you need to have medicals, which means you need to have insurance. Which
is absolutely criminal, to spend that kind of money while denying people the basic medical aid that they so often need. I think it's really, really ridiculous, and it makes me feel that we're more a part of the third world than the first world than we realize.
Well, that goes down to the human nature, doesn't it?
Yeah, and I know people don't, Americans in particular. I mean, I'll make it short, but they don't like to look at themselves too closely. But the fact of the matter is this is a very, very corrupt system of government, very gangster-like, that's got its hand in your pocket any which way they can get money from you, is going to tell you what they need you to do and what they want you to do, and that's going to be that.
Let me tell you how gangster it is. For those of you that do not know this, and you probably will not believe you when I tell you this, that doctors who go against the system are shunned, and even murder attempts are being attempted on their lives. I know this for a fact.
That I can't say for murder attempts. I'm not in a position to deny you, but I will be the first one to tell you that between the mafia and the system of government, I mean, you can't tell which is which sometimes, except for the fact that the mafia is more efficient usually, and they tend to get things done.
Yeah, well,
government not so much at times, but it's scary, and I think that's what I'm going to walk away from this show with.
Well, look, I know we got to wrap the show up. John, do we have any other updates? I know maybe a little bit on Peace Fund Poker, I think, would be an interesting thing. We've got second annual. Go ahead, John. I'll let you do it.
Well, actually, Peace Fund Poker is so new that I actually don't have the information for that yet myself, so Adrian's got one over on me right here.
Yeah, Peace Fund Poker, September 19th. We are going again. This year we'll support the Peace Fund, and we will have an initiative that will go towards it, but we are doing it again at the Microsoft facility down in Playa del Rey. Beautiful. The website is www.peacefundpoker.org. All the stuff is on there. It will be launched tomorrow. All the videos on there explaining how to join, how to support. You don't necessarily have to be there if you want to support. It'll be a fun day. We're going to be having a lot of different things this year where you online can actually see and follow the event and see the stats and really get involved in it, even though you might not be at the event. We're going to have a lot of celebrities. I already have a whole list of celebrities that have started coming to me to ask me about it. We're going to be posting them in probably about another week or so. As to the celebrities that will be there, you might be able to get one of your favorite celebrities and support them, or you might want to sit next to them at the game itself. So check out the site at www.peacefundpoker.org.
Brilliant. Looking forward to it.
John.
Yes, and as always, all of the other fundraisers and activities that the Peace Fund has going, you can find always on our website at thepeacefund.org, including the David Fry Memorial Fund golf tournament, which is coming up in August. There's a link to that on thepeacefund.org as well. We are raising money for a bowel transplant operation for a young boy named Alexander Cuevas, who came to us through the Children's Organ Transplant Association at COTA.org. Follow us on Twitter and Facebook, The Peace Fund and Peace Fund Radio. Follow Adrian at Adrian Paul 1. Follow Ethan at Combat Radio to find out about all of the incredible entertainment and charity work that Ethan is doing out there in the community.
John, thank you very much for coming in.
You guys always get it done.
Thank you for coming in today. We're over time right now. Thank you to all of you who have listened and all of you that support us. In closing, a quote from Paul Coelho. Only children believe they are capable of everything. This is Adrian Paul and Ethan Dettenmaier. We'll talk to you again.
You're listening to Peace Fund Radio with Ethan Dettenmaier and Adrian Paul, right here on LA Talk Radio.